Alright, as always, you can go to YouTube channel My Medical Nightmare and see 40 plus hours video on everything that happened to me. Alright, Ascension is now under investigation and scrutiny on a number of fronts. Ascension is, of course, one of the United States' leading non-profit and Catholic health systems. They have over 134,000 associates, 35,000 affiliated providers, and 139 hospitals under its management in 18 states. In the Birmingham, Alabama area, this includes St. Vincent's and associated hospitals such as St. Vincent's East. The largest medical corruption case in American history is now growing, and it involves Ascension. News came out in January 2024 that all of the pediatrician doctors at Ascension's Prospect Medical Commons, part of Columbia St. Mary's Hospital in Milwaukee, Wisconsin, have resigned and left their jobs there. Something spooked these doctors, and they had to exit their careers at this place. I think if you take a look at some of the videos on my channel, you might get some idea of the problems that exist in these hospitals. My experience as a misdiagnosed patient who went to Ascension for medical treatment and was misdiagnosed, possibly patient dumped. I believe that Ascension does business in the wrong way, and that has something to do with this. This news story was reported in the Milwaukee Journal Sentinel and other places, including BNN Breaking. It reads here, complete exodus of pediatricians from Ascension's Prospect Medical Commons. Ascension's Prospect Medical Commons has witnessed a total exodus of its pediatric staff. This unexpected departure has triggered concerns about potential disruptions in patient care. The final pediatrician of the facility left in December 2023, marking the end of a series of gradual exits by several pediatricians over time. And it mentions here that the pediatrician doctors left and did not inform their patients, which is, in the world of medical ethics and professionalism, irresponsible. But this is no surprise to myself, who had dealings with Ascension and their doctors. They are unprofessional. They make it up as they go along. They are lazy and corrupt. For many of the doctors, it's about money, not about services for patients. This is because of how messed up the medical system is in America. The doctors in the medical establishment have way too much power. Patients are at the bottom of this thing. They have very little power. They project and forfeit their power to the insurance companies, and the insurance companies are grotesquely, morbidly obese. The insurance companies in America are one of the biggest scams going, and partly because of the insurance companies, patients now can't get adequate medical treatment in the United States of America. I was a patient at Ascension's St. Vincent's East Emergency Department in 2018 and 19, and I was also self-pay. You can hear my own account in videos. They're up there on that YouTube channel. My experience dealing with Ascension's emergency department in Alabama, when you go into the ER, Ascension has a procedure that they follow, and apparently this extends to all their hospitals. What happened to me was I was taken to an examination room, and somebody entered and asked me a source of income, where I worked, or how I was going to pay for my medical treatment. And when I revealed that I was self-pay, I had no job and no source of income, the entire demeanor of the individuals involved in my visit changed. And I could notice body language and how I was being talked to. In my own case, I complained of neck pain and head pain. I thought I had broken bone in my neck. I was given several scans, x-ray, and CT in the Ascension emergency department. They came back and told me I had no injuries present, that I had just pulled a neck muscle. I knew that this was an error. I went and got those original images. I'll put them in this video. And as you can see for yourself, despite what I was told by nurses and doctors in St. Vincent's East and Birmingham, I had broken the underside of my skull. I almost died from the complications of this injury, but I survived. And I believe there's conspiracy, negligence, and medical fraud actually occurring in these Ascension hospitals and among their doctors and nurses. They know exactly what they're doing, and they do it on purpose. Please go back and watch my videos and listen to my own experience dealing with the representatives of Ascension when I tried to get my own misdiagnosis corrected. And you can hear what they say. They would not do anything to help me.
Thank you for calling Ascension. At this time, our administrative office is closed and our associates are working from home to limit the spread of the coronavirus. To leave a message in the general delivery mailbox, please press 2. Thank you. You've reached the Ascension System Office general mailbox. After the tone, leave a detailed message and someone will respond to your call. Thank you.
I'm trying to reach CEO Joseph Pediatric, and he can contact me at that number, and I have a message that I would like to give to Ascension. Between 2018 and 2019, I was an emergency department patient at Ascension St. Vincent's East Hospital in Birmingham, Alabama. I believe I had broken my neck. I had an x-ray, 2 CT scans, and later an MRI looked at by Ascension St. Vincent's doctors. Each time they had told me I had no injuries in this area, I knew their diagnosis was an error as my condition worsened. The area became infected and infested with parasites. By summer 2019, I almost died. I obtained my medical records from your hospital along with the x-ray, CT, MRI imagery, and discovered the truth of my injury. I had broken bone in the underside of my skull in the area of the condylar canal and occipital condyle. How the doctors could have missed such a large and serious injury over multiple hospital visits is inexcusable. I believe some element of organized corruption may exist in this hospital. I have compiled over 10 hours of video documentation on what happened to me on my YouTube channel, and the name of the channel is My Medical Nightmare. I believe I may have been a victim of patient dumping in the course of my seeking treatment, which is a violation of EMTALA, E-M-T-A-L-A. When I told medical staff associated with Ascension about my discovery that I had been misdiagnosed repeatedly, I was personally attacked and my psychological state was challenged, and this is reflected in medical records I obtained later. I could not obtain proper treatment or diagnosis for this injury because doctors and nurses that I would subsequently have encounters with would only entertain what the erroneous Ascension ER findings were. My mother, who was a nurse for 20 years, had the misfortune of working in an Ascension hospital. When I questioned my MRI findings involving St. Vincent's Ambulatory Healthcare Network LLC and Dr. Michael Brandt Ruff, MD, radiologist, in March 2019. My mother, who was a nurse for 20 years and worked in the Ascension Hospital, she was terminated from her job there around the same time. And so this phone call, I challenge the misdiagnosis of Ascension St. Vincent's East Hospital, Birmingham, Alabama, and I challenge the policy of this hospital. And Mr. Pediatric, I think you need to look into this, please. Please listen to my message, look into what I'm saying, and you're free to contact me. Thank you.